Hi and welcome to my channel. So in this video, I'm going to be talking about a topic that I'm really passionate about. Should nurses have a degree? Do nurses need to go to university? What do you think? If you're watching this and you're a nurse, I want you to leave a comment in the comment section. Did you go to a university or do you train in-house? What sort of training do you think is best for us to have as nurses? And the reason I'm doing this particular video is because people are constantly arguing about the fact that nurses don't need to go to university, nurses don't need to be academic, nurses just need to train in-house, and all we need as nurses is empathy, and it's to be kind, to be loving, to be sweet. That's all we need as nurses. And so obviously it's doctors that need to be academic because medicine is a profession that people see as being the academic side. Meanwhile, as nurses, we need to just train in-house and qualify as nurses. And there's no need absolutely to go have a degree. So if you're new to the channel, it's such a pleasure to have you. If you're a returning subscriber, again, I appreciate your time. If you haven't subscribed, I want you to hit subscribe right now. Turn on that notification button because I'm all about everything career progression in the UK, having the best jobs. If you're a nurse, you're a carer, you want to get into nursing, you've been procrastinating forever saying, oh, should I not? Is nursing for me? Is it not? Look, you want to check out my private coaching program because I have a program where I support with all of that. So check it out. And by the way, in case you're wondering, my name is Melvis. I'm a nurse. I work as an advanced nurse practitioner for the NHS in the UK. So I'm saying these things out of a lot of experience, out of a lot of frustration. When people keep saying, oh, nurses don't need to have a degree, nurses should not be going to university, nurses just need to have empathy, be sweet and cool and polite, and do as they're told, basically. So what do you think about all of this? Let me tell you that a nurse who has an excellent mastery and grasp of human anatomy and pathophysiology are going to offer a better quality patient care. And look, there is extensive research, there's extensive evidence supporting the fact that nurses that have a degree, in fact, do offer better quality patient care. And I know that this argument about whether nurses need a degree or not doesn't only come from non-nurses. Even many nurses, especially in the UK, nurses that are UK trained, for example, I see many nursing students saying to me, Melvis, what's the point going to university? The ACEs are very difficult. It's very stressful. Why are we writing all these ACEs? The truth is that research, human beings are continuously evolving. Drugs are continuously evolving and changing. Research is continuously ongoing and things are changing. So look, if there's research ongoing and there's any changes, we also need to adapt our practice as nurses, to the current times. And to adapt that practice, we need to learn, how to critically analyze that evidence that we're able to use. And I think that's why the Nursing and Midwifery Council, which is the nursing regulator, obviously in the UK, they are very keen on evidence, on saying that part of the code is that as nurses, we need to use the most up-to-date evidence. And you can actually lose your nursing license if you're not using the most up-to-date evidence, because there's that acknowledgement that we require that high level of knowledge. So I personally agree that as nurses, we 100% need to have a degree. We need to be degree trained. We need to go to university. We need to be highly academic for our patients to have the success that they deserve. Because I'm going to ask you a question right now. And by the way, I do have a newsletter where I send the best information about the best opportunities that there are in nursing, and any news updates that are happening. So if you haven't joined my newsletter, check the comment section below. I'm going to drop a link to my newsletter. So if you join it, when there's any updates, anything at all about nursing, especially in the UK, I'm going to drop it directly into your inbox so that you're always updated with everything that is going on. And obviously, if you're thinking of career progression, like I said, then my private coaching program is where you want to be so that I can support you with that, progress. Whether you're thinking of specializing, becoming a nurse practitioner, nurse endoscopy, specialist nurse, whatever it is that you're trying to do, or you're maybe a carer trying to get into nursing, having that transition, or just trying to change jobs and explore healthcare opportunities, then again, you should consider my private coaching program, because that is where I can work with you, in a closer level, just to make sure I support you to achieve those goals. So like I was saying, if you are not academic, how are you going to be able to deliver care to those patients? If you don't understand the disease process that the patient has, how are you going to better support them? And I'm going to ask you a question. If you had three nurses, this is what I always ask nurses who say that. If you have three nurses, for example, and one of them had 40% in their exams, let's say their final nursing exams, they passed with 40%. The second nurse passed the exam with 80%, and the third nurse passed the same exam with 100%. If you were to choose one of those nurses to care for you or for your loved ones, which nurse would you choose? And every single person always says to me, I would choose the nurse that had 100%. And then I say to them, why would you choose that nurse? They'll say, well, because I trust that they will know exactly what they're doing. And I say, so now do you think that nurses need to be academic? And then they'll be like, yeah, actually, now, Melvis, I see your point. So let me tell you, ITU nurses, for example, are some of the best nurses. They are very, very knowledgeable. And that's because in intensive care, they do so many courses. They learn a lot about the disease process. That's that pathophysiology, the human anatomy. And you can see that in the execution of the care that they are able to deliver. And I've also noticed that some of the nurses that trained in certain parts of the world tend to be really, really good in certain things. For example, just permit me use this example. Nurses that trained in the Philippines, for example, are so incredible when it comes to that, human anatomy and pathophysiology. They are so good. And this tells me that nurse training in the Philippines takes that particular aspect very seriously, and that's why nurses from the Philippines are so incredibly, skilled and incredibly talented when it comes to delivering nursing care, which means that if you have those nurses caring for you, the outcome that you're going to have is going to be better. And that is because they understand the disease process. So you need a nurse basically who understand what's going on in order to promptly escalate and get the doctors, to change the plan, prescribe, whatever it is that is needed for that patient. So you do need nurses to be academic. That's what I'm trying to say. I'm not saying every nurse needs to go and get a first class degree, but if you can get a first class, why not? That's obviously better. So as far as I'm concerned, nurses who are more academic generally, and research, supports that there's extensive research supporting that, which is why even in the UK, nurses used to be able to have a diploma and they were not trained in universities. But because of all the research and all the evidence, what it has proven and shown, nurses are now all degree trained, which means that if you've got a diploma, you need to do a top-up course in order to have a degree, for you to continue to progress, as a nurse. And this is the right step towards the right direction. So I think that regressing and going back to a time when nurses were trained in-house, that for me is regression. That is regression, because there are some people who are campaigning and urging nurses to be trained in-house, saying that you're going to be able to train more nurses. And this, for me, it's not about just having more nurses. You need people who know exactly what they're doing. You need nurses who are, academic. Yes, because like I've said, having that mastery of human anatomy and pathophysiology is going to give better outcomes for the patients. I'm going to again use another example. Nurses that trained in Portugal, Italy, Spain, for example, all those countries, when you think of like venipuncture and cannulation, how good are they? They are so good at it. If you want to take blood from a patient or you need a cannula practically, like on the wards and you're struggling, if you have a nurse who trained in any of those countries, look, when they're going to come there, they'll have a look and be like, hey, Melvis, this patient's got lovely veins. Couldn't you see that? And 1 minute, the patient's got a cannula and done. That makes a huge difference, because if you have a patient, for example, who is septic, you need a cannula in. If you have a bunch of nurses, for example, and nobody can cannulate and nobody can do any of that, and you have to wait for a doctor, maybe you have one doctor covering 3 or 4 wards, how long does that patient need to wait to have one doctor come and cannulate them? What is the outcome going to be for that patient? Again, when it comes to sepsis, there's extensive evidence showing that if a patient is septic, they need to have IV intravenous antibiotics as quickly as possible within the hour. So again, having nurses who have that excellent mastery of all of that, it's going to have better outcomes for the patients. And if you're a nurse, you know what I'm talking about. You've seen this in practice. This is something that is ongoing. And nurses that are more academic, I can guarantee you, the quality of patient care is completely different. And I know people argue and people carry on arguing. The nurses don't need to be academic. All nurses need is empathy. Look, if I'm having a stroke, I want somebody who knows what's going on inside of me. If I'm having a heart attack, I want a nurse who understands what's going on, because the more you understand what your patient is going through, the better the quality of care that you're going to be able to give. That's the point I'm trying to make. So saying that nurses don't need to be academic because it doesn't matter, it's for doctors to study and all that, it is ridiculous. That is so, like second century. This time around, as a nurse, so if you're watching this and you're a student nurse, please, you need to take your academic part very seriously. Human anatomy, pathophysiology, understand the disease processes, what exactly is going on in a patient. As a nurse practitioner myself, specializing in surgery, if somebody has got a bowel obstruction, for example, that's like one of the most life-threatening conditions that our patients come in with. If somebody's got a bowel obstruction, maybe because, they've got bowel cancer, or they've had surgery and then ended up with, complications, or whatever it is that has happened, you would need a nurse who has an understanding of what is internally going on with that patient. Do they need an NG tube? Do they not need an NG tube? How do you administer their medications? It could be that that patient's got medications administered orally. If as a nurse you can identify that they have a bowel obstruction because you understand the pathophysiology, you understand the disease process that is going on, then you can escalate to your doctors and say, look, do you mind to prescribe these medications IV? I have put an NG tube because the patient was having you need nurses who are going to be forward thinking that way. And that is where, for me, that academic side come in, because the academic side helps you not only to preempt the things that your patient needs, but it also helps the urgency of escalation that you're giving to the doctors. Because let me tell you, if nurses are not able to identify what the patient is going through to escalate promptly to the doctors have no idea what is going on. That's the thing. You don't want to wait until blood results come back and maybe doctors have a look and they're like, oh my God, look at the lactate. The lactate is over the roof. The potassium is so high. No, you need nurses who understand how to interpret those results, who understand what is going on with the patient. And that is where the academic side comes in. And that's why I gave an example of intensive care. Nurses that work in intensive care, they teach them that they teach them those things. And that is why you see that they're so good clinically, when it comes to supporting patients, because the environment where they work, they have extensive training that is available, which gives them that knowledge and that confidence to be able to identify all those different things. So please, saying that nurses don't need degree, nurses don't need to be academic, really? Leave a comment in the comment section. What do you think? What is your own experience? Do you think I'm just speaking, does it make any sense to you? Do you think nurses need a degree? Should nurses go back to training in-house? I understand that training in-house, you probably will be able to train more people and all that, but is it really just about the numbers? What about the quality of patient care that those particular nurses are delivering? Isn't that the most important factor that we should be looking at here? Shouldn't we be looking at the evidence that says that nurses who are degree trained actually provide better quality patient care? Shouldn't we be looking at all these countries that have, such good training when it comes to that human anatomy, pathophysiology? Shouldn't we look at the quality of that training, the quality of those nurses, and then acknowledge the fact that actually nurses having a degree, it's better? What do you think? Again, these are my own thoughts. These are my own ideas. Obviously, these are my own experiences. And yes, I strongly believe that that's the case. Again, leave a comment in the comment section. If you like the video, you like content like this, just, let me know. If you haven't joined my newsletter, check the comment section. Make sure that you join our newsletter, because I'll send you all the goodies directly into your inbox to make sure that you don't miss out on anything. If you haven't checked out my private coaching program, you're thinking of career progression, that's where you should be. You're a student nurse, you're struggling with those literature reviews. Again, you need to check me out, because I'm all about you getting that first class, being the best nurse that you can be, thriving, making sure you're delivering the best quality patient care to your patients, because that's what our patients deserve. Not nurses that are going to come and just be like, oh, I'm a nurse, all I've got here is empathy. You need to know what you're doing, because that's what your patient needs before anything else. Thank you for watching the video. Keep watching other videos I've done on the channel. Thank you.